Let's connect STIs to fever, a common sign your body is fighting an infection. Fever isn't an illness itself, but a symptom that your immune system is activated. Some STIs, like HIV during its early stage, can cause flu-like symptoms, including fever. Herpes and syphilis can also trigger fever, especially during initial outbreaks or secondary stages. When an STI spreads beyond the initial site, it can enter the bloodstream, causing a systemic reaction. Your immune system releases chemicals called pyrogens, which tell your brain to raise your body temperature. This higher temperature helps slow down the infection. A fever with an STI is a warning sign. Don't ignore it. It's your body's alarm bell for deeper issues. Why does your body raise its temperature when fighting an STI? Your immune system acts like a personal army, sending out cells to attack invaders. These cells release cytokines, messenger proteins, that signal your brain to turn up the heat. The result, a fever, which makes it harder for bacteria and viruses to thrive. This temporary temperature boost gives your immune system an edge. Fever also helps immune cells work faster and more effectively. While uncomfortable, fever is a sign your body is fighting back. It's a sophisticated defense, not just a nuisance. Recognizing this helps you understand why symptoms matter. While a fever can sometimes be a sign of an STI, it almost never appears by itself. Instead, it's usually accompanied by other symptoms that can help you and your healthcare provider figure out what's really going on. Recognizing these additional signs is crucial because many STIs can be silent or subtle at first, making them easy to miss if you're not paying close attention. One of the most common warning signs is unusual genital discharge. This can be clear, white, yellow, or green and may have an unusual odor. Sores, bumps, or warts that appear around the genitals, rectum, or even the mouth are also important to notice. These changes can be painless or uncomfortable, but either way, they're worth getting checked out. Painful urination or a burning sensation when you pee is another red flag, especially with infections like chlamydia or gonorrhea. Discomfort during sex, or even just a general feeling that something isn't right, can also be a clue that your body is fighting an infection. For women, pelvic pain or pressure that doesn't go away could signal an STI, especially if it's new or different from your usual cycle. Men might notice pain, swelling, or tenderness in the testicles, which can sometimes be mistaken for a minor injury, but may actually be a sign of infection. Skin changes are another clue. A rash that appears on your torso, hands, or feet, especially if it's not itchy or doesn't look like your usual allergies, can be a sign of syphilis or other infections. Sometimes these rashes are faint or go unnoticed, so it's important to check your skin regularly. Swollen lymph nodes, especially in your neck, groin, or underarms, are another sign that your immune system is working overtime to fight off an infection. You might feel small, tender lumps under your skin, or just notice a general sense of swelling or discomfort. General symptoms like fatigue, muscle aches, and sore throat can easily be mistaken for the flu or a common cold, especially in the early stages of viral STIs like HIV or herpes. If you're feeling unusually tired, achy, or run down, and you can't pinpoint another cause, it's worth considering whether an STI could be the reason. These signs are easy to overlook, especially if you're busy or stressed. But context matters. Think about your recent sexual activity, any new partners, or changes in your health. Even mild symptoms can be important clues. If you're sexually active and notice any of these symptoms, don't ignore them. It's always better to reach out to a healthcare provider, get tested, and have an honest conversation about your concerns. Early detection can make a huge difference in treatment and prevention. Don't dismiss these signs or hope they'll just go away on their own. Taking action early can protect your health and the health of your partners. Your body is always sending you signals. Listening to them and acting quickly is one of the best things you can do for your well-being.